Unfortunately, trauma is part of too many children's lives at too early an age. Environmental factors like chronic stress and other traumas like abuse, neglect, or violence in the home, collectively known as adverse childhood experiences or ACEs, can sometimes manifest risky behaviors later in life. During adolescence, for example, some young people may develop unhealthy coping mechanisms that are harmful, like substance use. Charmin story is one of childhood trauma resulting in her becoming a patient with substance use disorder. However, Charmin's story is also one of incredible resilience, having overdosed twice and having contemplated suicide before starting her own recovery journey and assisting others in their recovery journey. Let's watch this story.
So my name is Charmin. I'm the coordinator for the Fayette County Harm Reduction Alliance. I'm a recovery coach, and I'm also a person in long-term recovery from IV drug use. My story goes back to early childhood. I was born and raised by a mother that has multiple mental health diagnoses, such as schizophrenia, bipolar, depression, and anxiety. I was raised by a father who was an untreated alcoholic and has mental health issues himself. My mom had a gambling addiction growing up. And so early on, it set the tone in our home for lots of physical, mental, and emotional abuse. And not only was my mom physically abused, my brother and I was as well. Three things I had learned very early was we had many secrets: don't talk, don't tell, and don't feel. I remember one morning being awoke to my mom screaming and begging my dad not to kill her. My dad had my mom held up against the wall in the kitchen, and I was about 5 years old. And she was just screaming and crying and begging him not to kill her. And my mom had spent money that was unaccounted for, and so it goes back to that gambling. I remember just so many times that after my dad would beat my mom, that he would get in his truck and leave, and then we would be there to clean up the glass, and we never talked about it. My dad would come back. My mom would, she would get up out of the bed, or and so we were just quiet. Us kids were always just like as quiet as we could be, to be the best that we could be, so that he wouldn't be mad, it wouldn't hurt her. And what I learned was that love was angry. Love was hard. I tried to do well so that things would be better. When I started school, we were very poor. My dad worked, and my mom was a stay-at-home mom. We didn't have running water until I was in the 4th grade. My mom had this old ringer type washer, and even in the winter, she would hang the clothes out on the line to dry. So oftentimes our clothes would be soured. And I remember we would take baths in the creek. So my name was Charmin, and we were poor, and I had cavities in my front teeth. So I had a speech impediment, and I was made fun of a lot. And that's what I knew. That was my daily life, was not knowing if I was going to get off the school bus, to my mom even being alive. That was one of my biggest fears, was that my dad would kill my mom. My first drink was 9 years old. I drank beer when I was 9 years old, and I'll never forget that feeling of warmth. And I describe it as walking outside on a sunshiny day and feeling that sunshine hit your face, and you just have like this amazing feeling. And that's what the alcohol felt like inside of me. It was warm, I was safe, and maybe even a feeling of maybe liking who I was. It was just a secure feeling. And so I think that was a feeling that I started to long for. I remember being around the 3rd grade, my mom started taking my sister and I to the store to shoplift. And she would send us in the store, and we would get things, whatever it would be. And I would do it to cover up a lot of things, I think, for my mom. So the secrets, I lied, I stole, I was angry. When I started junior high school, I started surrounding myself with kids that accepted me, and being able to skip school and not take that bus back home to the country. I would do anything not to go home. I just didn't want to go home. You just never knew. You never knew if my dad was going to flip the dinner table, if he was going to break another lamp over her head, if he was going to break her fingers. She would say she stayed for us kids. My dad said if it wasn't for us kids, he would leave. So I think that put like a lot of guilt on me, like it was, they stayed together because of us kids. In reality, us kids would have been better off had they have separated. So I fell into that cycle of drinking and smoking pot real early, and it became, I think, a coping skill for me. And so everything that I hated about my parents, I lied, I cheated, I stole, I was angry, I fought. I would fight. I had an older sister that was overweight. My siblings were in special ed, so kids made fun of them. And so I would fight to take up for my siblings because it hurt me to see them being made fun of. And I missed like 80 some days of school in my 8th grade year, and they labeled me incorrigible and they passed me on. I overdosed on 2 different occasions while I was still in school, and one time I remember they found me like laying out in a yard, and I was naked, and I was unresponsive, and I remember when I woke up that my parents weren't there, and the nurse said that they weren't coming. They were mad. My parents were mad at me because of my behavior. And looking back at it, I think I just wanted maybe someone to love me, to help me. I just didn't want to live. I didn't want to continue to go home, and I didn't have those people in my life, even the people at school. Like, I was a problem. So no one ever seen that I was a child in need. I was just labeled incorrigible and a problem. And it was just too much for people to deal with. And so I ended up quitting school in high school. I would attend school, and I probably don't even have 12 high school credits. I was just continually passed on, and I quit what should have been my senior year. And so that led me to being eventually having my first child 2 weeks before I turned 19 years old. And so for me, there was a desire to be a mom, to raise my first better than I was raised, but I didn't know how. I didn't know how to do different. I didn't have people in my life to help guide me and support me. And what ended up happening with me, I was addicted to shoplifting. I was addicted to pills. I was addicted to alcohol. I have a substance use disorder. I have mental health diagnoses of bipolar, depression, anxiety, PTSD, and I had an eating disorder. To expect this young child to break those cycles was what the criminal justice system wanted from me, but I didn't know how. And so I have spent over 10 years of my life rotating in and out of the system. Never was I ever arrested for anything other than DUIs, shoplifting, all low-level nonviolent crimes. But yet, every time I would go into the system, I would be sober, or else being in the system was another opportunity to learn different coping strategies. So in there, mental health medications are something that's highly abused, and Benadryl was another piece inside the system. Anything to escape those thoughts inside my head. Like being raised by parents that weren't healthy, I on top of the mental and physical abuse, being told that I was hated, and the names that my own parents would call me, they too told me I was worthless and that I would never amount to anything. And so I believed that. I never had like dreams of growing up to be anything. I never had a dream of going to college. My dreams as a younger person consisted of getting out of that house. That was my only dream, and that was my only goal. And then when I did, then I had a child, and then I started parenting him the same way I was parented, and I stayed in an abusive relationship. And every time I would get out of jail, I would go right back to doing the same things because I didn't know how to change. There wasn't any help. It was a temporary holding and then being released right back to society, or going back to my parents' house where it was like I was already defeated before I got there. So throughout my life, I learned my own way to be. I learned that I could go to a provider and I could get the medications, and the medications that I ended up eventually, I had a prescription for 120 pain pills, and they would be gone in 3 days. And there was never questions as to why I was taking all these pain pills. It was just, then early on, there weren't all of the regulations that we have today with medication. So what that led me to was taking Oxycontins. There was just never enough. I would take 20, 30 pain pills at a time, and there was never enough medication to help me get through what was going on inside of me. And that led me to, I remember the day that I paid $80 for an 80 milligram Oxycontin, and I just got well. It was, I just got well, and that wasn't enough. And that took me to heroin, and eventually I had a second child, and when he was like 3 years old, I ended up on heroin, and I continued until I lost everything that we had and I had with my second son's dad. I remember the day that I was arrested coming back from the city, Dayton, Ohio, and the Jeep was impounded, and we still owed money on the Jeep. And I was arrested in Wayne County, and after 48 hours, they OR'd me. And I went to the impound, and I sold them the Jeep for $75, just enough money to get back to Dayton to buy a gram of heroin. Like, it was always about the immediate escaping what was going on inside of my head, because I went to jail. And so that just added to the guilt and the shame and the pain and the self-hate. Eventually, in around 2013, that sentence from Wayne County, I went into a program called, it was a therapeutic program. And so the system had started to change, where they were offering programs, and now they do offer programs for substance use inside, if you're lucky enough to get into one. And through that program, I started working on me. I didn't even know why I did what I did. I didn't even know why I was so angry and why I didn't like the person who I was. When I started dissecting the pieces of my life and looking back to, I wasn't even 6 years old, and I was molested by 3 of my cousins. And I think that started the body image issues that I had. And then eventually I've been raped and abused, sexually abused by men and women. And then not even, my parents' sex wasn't something that they talked about. I didn't even tell my dad about my cousins molesting me because I was afraid he was going to beat me for what they done to me. Like, sex was bad. It was shameful. And it was just something you didn't do. And so I didn't even have that person that I could tell it to until I was 30 some years old. Those were secrets that I just had to keep inside. And so when I was in the program and starting to look at my life, and I started understanding, but I still didn't want to tell all them deep, dark secrets. And so after being released from prison that time, I went on to work release. And while I was incarcerated with structure, I done well. It was like I had a goal, and that was to get back home to my kids. While I was in work release, I had a job that I was promoted to manager. I was downtown Indianapolis. I saved a lot of money. Just a lot of things seemed to be going good. Yet still that same person with those same coping skills was released back to society. And I was on parole, and like I had all of these expectations, no driver's license, and all of these demands that they want from you. Within 2 weeks of being released, I was back shooting dope. And this time I was back using drugs with my 19-year-old son, the person that I loved more than anything in life. And I just didn't, like, there was nothing left for me, like inside of me. Drugs, heroin completely had taken over everything. And that's all I wanted. I lived for the next fix. That's all I cared about, was getting back to the city to get high. And there were days where I would put my youngest son in that car seat, and I would go to Dayton, Ohio, no driver's license, just enough money to get a gram of heroin and to buy my son a Happy Meal. Because in my mind, it was justification. I would give him that Happy Meal, that toy, and I was getting what I wanted. And I was so far gone mentally that that some days there wasn't even enough money left over to buy water. That the nearest piece of whatever it took to get it injected in my vein was what I was doing. I've shot mud puddle waters. I've mixed mud puddle water with heroin. I've shot toilet water, and I know that sounds awful. And I can't even believe that's the person that I was, but I've done that because when you're in that bathroom, you're so afraid to walk out of someone seeing you, and you only have what you have. And so to draw up water out of a toilet and to mix it in a pop can bottom, because it's usually what you have. And it's whatever's closest to get it into your system. My son came and saw me right the night before I left for prison. And when Drayden left with his dad that night, he was only 7 years old. And the jailer handed me a letter. And this letter was wrote in, it's a green marker. And it says, "You are so a good mom, and I forgive you." And I knew that if my son could forgive me, and he was about to be put on a bus every morning without his mom, getting off a bus without me there, just everything that he was about to go through. And if he could forgive me, then I had to learn how to forgive those people that had hurt me in my life. And so I took that letter on to prison with me. And that was something that I had to learn how to do, was forgive people that had hurt me. And I didn't know how. And it was a huge process. My story takes me back to being arrested again in 2014, July 3rd, 2014, I was arrested. headed back to the city, 1:00 in the morning. And I was so tired, and I just didn't want to live anymore. And that night that I was arrested, I knew that I just couldn't keep going, and I didn't want to keep going because I couldn't stop doing drugs. And I knew I was going back to prison. And I knew that that my parents loved and supported me the best way they knew how. But I also knew, like, they hated me. They hated the person that I was. And my kids, like, they just wanted a mom. And I couldn't be her. I had planned to commit suicide that night. I just didn't want to keep living with all this pain inside of me and all these secrets and the way that people would treat me when, like, even going to the emergency room. I was a known IV drug user. I wasn't as important as the next person. My life was so invaluable to so many people except my children. And I don't say that because I feel sorry for myself, because today I see myself differently and people treat me differently. But that's only because I found a pathway. So what ended up happening, thankfully for me, many people were placed in my life. And my oldest son said to me, he said, "Mom, I'll be fine, but Drayden needs you." And God placed some amazing woman in my life that evening, and I call her my angel here on earth. And some of the things that she said to me, and the thing that stuck out the most was, she said, "Charmin, I sucked as a mom, but I'm a darn good grandma." And that woman stood beside me, and she loved and supported me without judgment. She heard me, and she wanted me to know that I mattered. And so I ended up going back to prison. And during that time, I went back into that program, and many people in my life. There was the director of that program. She mentored me. A woman from the outside mentored me, and gave me 32 weeks of her life. And I did work a 12-step program inside the prison. And I had a life-changing experience inside prison. I gave it everything I got because I knew I was going to die if I didn't change me. And I wanted to, I just didn't know how. But God placed every single person in my life that I needed to have to help me learn how to forgive. And so April 2015, I was released from prison. And when I was released from prison, I had a few clothes and a GED that I got when I was a patient in Richmond State Hospital. And since then, when I came out of prison, I was just willing. I was willing to do whatever it took to get to be where I wanted to be in life. And I still don't know where I want to be, but I was offered a job landscaping and mowing 5 days after I came home, and I took the job. And I started going to peer support groups, and I started doing anything that I could positive within this community to change me and to be connected. And working that 12-step program helped me find something that I never knew existed, and that was a connection to a higher power. And so I didn't think God applied to my life, because the God that I knew was vengeful and not loving and not forgiving. The God that I grew up was like a mean God. So I learned more about spirituality, which brought me to where I'm at today with my connection. And that's what changed my inside, was having a spiritual connection. So one time I was someplace, and I asked what I could do, and they told me to go to the Drug Coalition. It was actually the Drug Task Force. And so I showed up at the Drug Coalition here in Connorsville, and there were a bunch of professionals at that meeting that day. And they're like, let's go around and introduce ourselves. And at that time, I was just going to school. I had started school, online school, because I still don't drive. So I didn't have that ability to get to in-person school. So as they were going around the table, and they all had all these titles and whatever. And I said, my name's Charmin. And at that time, I use language such as I'm a drug addict and alcoholic, and I just want to make a difference. And so as time has went on, I no longer refer to myself as a junkie or a drug addict, or I'm a person with a substance use disorder. Most importantly, I know I'm a person today. All the labels that have been placed on me by society, a victim, a victim of rape or molestation or incest, none of those are who I am. Those are things that happened to me. I am a person. Today, I'm a person with a bachelor's degree in psychology. In July of this year, I graduated a bachelor's program in psychology, and the same day I became a homeowner. I am 6.5 years in recovery now from multiple mental health issues and a substance use issue, and I'm a mom. I am a healthier minded mom. I'm a mom of a 14-year-old that is a normal teenager. I'm a mom of a 27-year-old that is on mats. He has found his own program of recovery, and he's very successful. I'm a very proud mom of 2 boys, and I get to love, support, and encourage them. And I do that every single day. I might not reach out to my oldest every single day, but every day I get to wake my youngest up with breakfast before school and encourage him. I don't belittle my children. I've learned a different way to be, and that's because people invested in me, and I've learned tools through my recovery. So anyhow, getting involved with Celebrate Recovery helped me. There was other support groups at that time, but it was the people that heard me without judgment, the people that they were there with open arms, and they were people that had been on similar pathways.
Harm reduction promotes health and well-being for all. I would like my child, my parent, my grandchildren, my neighbors to have access to whatever materials, whatever supports they need to be healthy. This allows that opportunity. It's private, anonymous, and non-judgmental. I want the people I love to have access to a program like this.
We are a syringe service exchange program. We reopened January 22nd, and when we reopened as the Alliance, what we've done is we partnered with Meridian and a team from IU University, Reed Hospital, to get to where we're at today. So reopening the program, what we did was we changed some things to revamp the program and to be able to reach more people. The purpose of the program is to reduce the spread of infection of Hep C, HIV, and other contagious diseases throughout our community. And this is our office, but when COVID started, I actually had to close the program down for a few days. And then what ended up, participants started reaching out to me. And then as everyone knows, we saw the increase in overdoses. So I started doing bicycle deliveries. I started meeting participants right where they were at. And I wanted to make sure that they had Narcan available. Just because COVID happened, their world didn't change. And if anything, it got worse because a lot of our participants had lost services that they were used to being able to get, like some MATS providers like shut down, and they just shut down without notice. So what we've seen was an increase in setbacks. So I want to make sure that we were able to still see our participants and keep them as safe as possible. So what I'm going to do is explain what we have and what we offer our participants. The program is completely confidential. When a participant comes, we go over some things like, just because we give you syringes, it's still not legal in Indiana. So it's kind of like contradictory there. We want people to be safe and we want to stop the spread of infection throughout the community, yet they still can be arrested for possession of the syringe. So since COVID started, what I do is I pre-bag syringes. We have 2 different size syringes. Sometimes participants prefer a long one versus a short one. It just depends on their own personal preference. So I pre-bag syringes to make the process a little faster so that they're not here as long, or I'm not having to spend as much time with getting those supplies ready. Each thing that we give the person is to reduce the harm within themselves, to stop the spread of infection within their own body as well as among other users. And the goal of the program is to get the participant to use each syringe once, dispose of it, and then bring it back to us. And we know sometimes that they get their syringes confiscated. A lot of our participants are transient, so they go from place to place, they couch surf, they stay down by the river, and sometimes we know that they don't bring the syringes back. We encourage them to, so that we can dispose of them safely. Typically, when a participant would come into the office, this is like a self-serve area. And everything that we provide here, they can have as much of as they want. So alcohol pads, these are little cotton, because for someone that injects drugs, what they do is they mix drugs up in something similar to this. And if they don't have cotton that we provide, they'll use a piece out of a cigarette filter. And so the cotton that comes out of the cigarette filter, they're more apt to, the syringe will pull that really thin cotton up and they get what's called cotton fever. And so their body starts to react from that and they start shaking. They have hot, cold sweats, and it's their body's way of trying to reject it. So if we're able to give them these cottons that are more tightly woven, then the chances of them getting cotton fever are slimmer. So what happens is a person will take their drug and they'll put it in this and then they'll mix it up. And then everything that we give them, we want to encourage them to use one time and throw away. So all of this stuff is disposable. And so they have their cottons, they have the cooker, and then they also, we provide sterile water because, as I said, we'll resort to whatever means possible. And a person who injects drugs, it's very common for them to, if there's a Gatorade laying in the back seat, they'll use that. And what we want to do is we want to keep them healthy as we can, help them learn how to stay as healthy as they can until they, or if they ever become ready to make those changes. So we provide alcohol pads for them to clean the area that they're going to inject through, the water, cotton, cookers, and then even the tie-offs, or professionally known as a tourniquet. Because if they don't have something like this, they'll use a cell phone cord or a purse strap. And what we know is that breaks down the area in the veins. And so if we can encourage them to use this, if they do tie off, then that keeps their veins healthier. We provide contraceptives. So we encourage people to use safer sex supplies. So sometimes we have the flavored condoms. We have safe sex kits. And so in these little kits, there's lube and a condom. And so everything that you see here is available to our participants each time we see them. And then we have our sharps containers, and we have different sizes. So Oftentimes they like these because they're small and they're easier to conceal. And so then they bring them back to us and then we dispose of them. We also take back syringes from diabetics. We encourage anyone in the community that needs syringes, diabetics, we give them free of charge. If they need syringes, then they can come here as well. We take back syringes, used syringes from anyone. We'll take them back. We'll give sharps containers to anyone. Another service that we have is hygiene kits. As I said, a lot of our participants are transient. So to have a toothbrush and toothpaste is a big deal. I have some hygiene items laying here that we have available. And this is a washcloth. It's a disposable washcloth. And these are just little bars of soap. These are little packets of deodorant and shampoo. To someone that doesn't have this, this is just I care enough about you so that you can feel good about yourself today. And they may not have any place to live, but they can go into a public restroom and they can at least wash themselves and have a little bit of deodorant to make them feel better. In the wintertime, a lot of our participants don't have transportation, so we're able to provide a pair of gloves, a hat, or a warm, dry pair of socks. And to see someone's face when you offer them this, that's just rode their bicycle here or walked here, and this just means I care enough about you, and they're so grateful. Right now, we've purchased these bandanas to give them because our participants don't have the extra money to go buy a mask. And many times I've had women reach out to me for hygiene items, for personal hygiene items, because if it comes down to being able to meet their need of getting their supply versus the hygiene item, they're going to get their supply because that's their everyday coping skill. And so we're able to provide that. Everything that we provide here is just a means to help someone stay healthy and safe, and to say I care about you, and that's it. To see someone that is using a needle, sometimes some of the syringes that's been brought back to us are glued. They will piece them back together, the plungers back together. The needle is so bent and burnt because they get clogged. And so to see someone when they're starting to heal up and their wounds and their arms are getting better, and they'll come in and they'll show you their arms, because we provide wound care. We have like triple antibiotic and gauze and things like that, and we provide that to them, and they want to show us those milestones as their arms are healing, or an abscess that's going away. And when they know that we care and that we're meeting them right where they're at without judgment, they just unload that heaviness, and they just keep coming back, and they're so grateful. Every week every participant is offered Narcan. And if they don't know how to use it, which they are the first responder, individuals with substance use disorder, they are the closest to the first responder that's out there on the street. And so this is my favorite tool, if I had to have a favorite, because this is the life-saving tool that we just can't get enough of out there on the street. Every week I have someone that reports a reversal, that they have saved their friend's life, or that their Narcan was used on them. And I know it's the mindset of, like, oftentimes people are like, well, when's enough enough? Well, it's never enough. There's never enough. We never stop giving diabetics insulin, and we never stop reviving the person that has had a cardiac arrest, that continue their behaviors. Why would we stop giving Narcan to someone with a substance use disorder? It's a chronic illness, and we have to continue to do all that we can to save their lives, because they are somebody's loved one. And so this is what we give them, and we're very fortunate right now that, you know, Overdose Lifeline is helping us with the supply, Indiana State Department of Health. So it's becoming more prevalent for us because it's very expensive. but every week we offer this to every participant. And if they don't know how to use it, then we go through the training. But this is one of my favorite tools.
The harm reduction program comes together from a lot of community partners. Without any of them or one of them, it wouldn't be possible to be here. Family Services and Prevention Programs is our umbrella agency. They help us with compliance and fiscal issues. HRSA as well as Reed Health contribute financially to have the harm reduction program. We're here at Meridian Health, and they provide our space, secure storage for us, as well as support for people coming in and out of the building. Had so much input from many community stakeholders, the county commissioner supporting the opportunity to have this project, as well as the Fayette County Drug-Free Coalition and the Systems of Care. So many partners come to the table, volunteer their time, their talents, their ideas, and their dreams that makes this program happen. Harm reduction is one part of building a healthy and resilient community. Our agency looks at prevention with youth and with adults. We have programs within the school that use scientific evidence-based programming to all grade levels. We also have after-school programming, and with adults starting to work with pain management and how to work with their doctors to start with something other than an opioid for their medical concerns. So we're looking forward to working more on that in this upcoming year. You can find more information about the Harm Reduction Alliance, the hours and places that it will be open on Facebook. There is a Harm Reduction Alliance Facebook page, as well as a Prevention Works and a Stigma Reduction. And dates, times, and upcoming events, all that information is posted regularly.
Just because they bring back 0 syringes, as long as they're coming to us, we know that we're able to connect them to services when they're ready. We're able to encourage them and support them, and we know they're alive. And every time they come here, they know when they walk away that they matter. And that's so important because they do matter. They are somebody's someone.
Well, welcome back, and thank you for that wonderful story of sharing of your resilience, Charmin. Charmin, are you joining us today?
I am. I'm here, Cody.
Wonderful. Well, thank you so much for first off sharing your story, but also thank you so much for sharing about the wonderful work that you're doing in Fayette County with the harm reduction program. Amna and I were able to go over and visit with you twice. Once when that program was going, and definitely a highlight of my career, seeing what you were doing and seeing the ways that you are caring and loving on your community. So thank you for everything that you do. We've had a lot of comments come in the chat. Some have come in directly to me and others to everyone. I'm just thanking you for sharing your story. Kathy said, Charmin, you're such an amazing person. Thank you so much for sharing your journey. What a blessing to have you here to make a difference in our community. And Maddie, you're an incredible Charmin. You're meant for that role in harm reduction. So I'd love to open it up. We have Charmin with us. For others who may have questions or discussions or advice from Charmin, love to open it up. Or if you have any private questions that you'd like to ask Charmin, you can always use this link that we're showing right now. We're happy to share those with Charmin and get back with you, or have Charmin connect directly with you as well. But Amna, any questions to start up our discussion with Charmin this afternoon?
I just wanted to ask you, Charmin, last we saw you, you were just holding that once a week at Meridian Health Services. Are you still doing that, or have you expanded a little bit more? How are you guys doing right now with the harm reduction program?
So due to COVID and some of the restrictions that we have had on the physical building, Meridian has been amazing with us during this and trying to get back in there because with COVID restrictions and space being, it's hard to be inside of a room where you have to distance yourself 6 foot. So for our protection and our volunteer and their protection as well, we have had an amazing opportunity presented to us. And so we have a mobile unit that we are going to be able to extend our services. So here within the next few days, we're in a pre-planning stage right now, but we have some opportunity where we're going to be able to offer services at other locations as well.
That is great, and I think the community needs this. One more thing I wanted to ask you, Charmin. The entire state of Indiana, I think the nation has seen an uptick in the number of the overdoses due to opioids and the number of the Narcan events through EMS. How has your community been affected by it? Have you seen more of those in your community, and how is your community handling that?
We are like every other community. Our numbers as of right now are double what they were for year total last year with overdose deaths. So COVID and just the lack of support and the lack of connection. I mean, isolation is the enemy for someone with a substance use disorder and using alone. And then so again, like I had mentioned, multiple services had been shut down, even match providers. So we have had over 300 self-reported reversals through the program since January.
Wow.
That is a very high number, but I'm sure that your program is doing a lot, providing the necessary equipment and the medication that is necessary to reverse the Narcan, reverse the opioid overdose through the Narcan. So great job that you guys are doing. I just wanted to mention here that your program is also funded through another InROC funding. That is not the funding that you see that we have been talking about, just making sure that we make that distinction for our IU partners who have that InROC funding. Any other questions that we have for Charmin?
None have come in the chat, but for our participants, please feel free to unmute yourself. Or Charmin, is there anything else you'd like to highlight or share with our audience today, or other takeaways from our presentations thus far?
Something that I've been on the entire time, and I was thankful for Paul Freed's presentation and for the work that he's doing. I do think diversion programs and helping instead of just punishing people who have substance use and mental health disorders, like here in Fayette County, we don't have a high violent crime rate. So we have a lot of low-level nonviolent criminals or individuals that continue to have that make our recidivism rate high. So I'm so thankful that this opportunity and him saying that he wants to expand on the program. I'm grateful for where we're at with harm reduction and some of the opportunities that we have where we are going to be able to start training more recovery coaches here within our own community and getting them out there. It's needed. There's just such a breakdown in what can be handled in, I think, the clinical setting and what can be handled among peers. Peers are more apt to give that information and feel that they're able to tell that other peer that has that lived experience and where they're at and what they need versus the clinical setting where sometimes they're just there for an hour. As to a peer recovery coach, they can take them to a meeting. They can just do so much more with them and help guide them on that journey. So unfortunately, due to all of the losses that we have had, we are seeing more funding and more opportunity becoming available. So it's a matter of working all together and coming together so that we can save that next person, so that we can stop that next child from being taken from someone that has a substance use disorder. They're sick people and they need help. As I didn't know how to change, but when given that place of healing and connection, support, and resources, people will change.
Thank you so much, Charmin. I think that is an important message that we've been trying to also explain throughout these presentations. I think you just said the right word, that there needs to be those resources where people who are suffering from substance use disorder can actually access help and not necessarily end up in incarceration. There is another comment for you. Says, thankful for Charmin's transparency. She's a very brave woman and an inspiration to the others. So thank you so much, Charmin.
Thank you for the opportunity.
Thank you. And I think it's also important to highlight, we mentioned it when we came back from break, but there's an opportunity through the IU Center for Rural Engagement and the InROC program for Narcan training that can be offered virtually. So you can go out to our website for that information. And as discussed throughout Charmin's story and about the program that she manages, Narcan is a lifesaver and a wonderful tool that everyone can be trained and carry with them. So thank you, Charmin.